The root of an eyelash looks like this under a microscope, and beside it is Demodex follicularum, one of the 2 species of mites that mostly live in hair follicles and oil glands. These mites are associated with eyelid margin diseases such as Demodex Blepharitis and meibomian gland dysfunction. The eyelid margin has long been an underestimated structure as far as ocular surface health and dry eye are concerned. Not anymore. Thanks to a consensus group from the Intrepid Eye Society that put together an eyelid margin health approach in addressing both Demodex Blepharitis and MGD, the faculty's consensus on eyelid margin health, published in this Cookie Magazine supplement, hopes to raise awareness and promote increased frequency of screening for improved patient outcomes.
Continuing the education on eyelid margin health, I'm Cecelia Koetting, and we're currently filming 1 of 4 educational videos on the complement, the consensus statement on Demodex Blepharitis and meibomian gland dysfunction. So we've got 2 decision trees, one that's on Demodex Blepharitis, and the first part, do they have scruff or do they have collarettes, right? Because we're starting to try to decide if this patient has just bacterial or if they have some kind of Demodex component to it, so then we know where to go from there with treatment. If our patient has scruff, we're going to be more geared towards treatment with just cleaning and potential antibacterials if needed, versus our Demodex patient, where we're then going to look at treatments for that, which may include lotilaner, also cleaning, but it may be more, for me, tea tree oil based or ochre based. And then off of that, we have this lovely little rosacea tree. And if they have rosacea, we might be adding an IPL. You may still do that even if they don't have rosacea.
When distinguishing and diagnosing meibomian gland dysfunction, there's 2 big things that I like to think about: obstruction and inflammation. And a lot of times you'll have one more than the other, and that's the primary go-to for my treatments for meibomian gland disease. If I'm seeing a lot of obstruction, I want to treat that first. Those usually respond best to thermal treatments, and also IPL has some role there as well. If I'm seeing a lot of inflammation around the glands, and that can sometimes present itself with more symptoms, tenderness in the lids, tenderness with expression, then I'm going to want to manage that inflammation. IPL does a great job of managing inflammation as well as some of our pharmaceutical options.
Yeah, and also that can indicate infection as well a little bit, which is definitely where, if you have an infection, we want to make sure that we use use an antibiotic, whether that be doxycycline, or I personally am a fan of oral azithromycin using a Z-Pak. There's some benefits both directions, but as far as getting the infection under control while also addressing everything that Jake has mentioned as well. So with Demodex Blepharitis, we in the last year have had FDA approval for lotilaner, and that really, for me, in my clinic, has changed what I'm doing 100%, no question. I'm getting much better results. I used to have a very different conversation with those patients about, hey, you've got Demodex Blepharitis, we're probably going to be going through IPL or these pulse doses of tea tree oil for a month, like that was heavier dose, 3 to 4 times a year. And what I'm finding with lotilaner is it's controlling patients and getting them to a baseline where I'm able to maintain with daily lid hygiene much better, and we're not getting these really aggressive flares that we were having before. So that's how I would feel on that
with
one.
MGD, I agree. It goes back to obstruction and inflammation. We want to target the main offender and then reassess. So if I'm seeing a lot of inflammation, we want to start thinking about how can we treat that inflammation with pharmaceuticals, and then again, our light-based therapies, whether it be intense pulse light, low-level light therapy is becoming a new innovative thing that can be an option for our patients as well. So some of these light-based therapies can be an option for more of that inflammatory conditions as well as pharmaceuticals. Again, thermal pulsation I think is still the go-to for obstructive meibomian gland disease. And then, like you talked about with the dental model, we need maintenance. We need to keep things good. So we need to start building in those good habits that our patients need to have at home.
So there's also some really interesting data. Anecdotally, I think we've kind of also noticed in clinic that while we're improving patients who have Demodex blepharitis, we're also seeing improvement in their meibomian gland function. And there was a poster just presented on a study that was done looking at that in patients who had Demodex blepharitis and meibomian gland dysfunction, and looking at an increase in their meibomian gland function over, I believe it was a 6-week course. So similar to what we do for same thing we do for Demodex, it's twice a day. And they did find that there was an improvement, and, you know, confirmed with what we've been seeing in clinic.
Yeah, it just confirms that there is this overlap between dysbiosis in our lids and meibomian gland function. Yeah. So if we clean up the lids, we're going to help those meibomian glands function better, you know, have some downstream effects on actual meibomian gland function.
Yeah.
And I think it really gave us a lot of great evidence about how effective this treatment is against Demodex. The safety profile was amazing. It was very tolerable, very, very few adverse events, but the effectiveness in regards to Demodex eradication and collarette cure were just really overpowering to me. I was really amazed with how strong that data was.
And with data, it's even better when we get to see it in practice and see that it's actually holding up to the data, which has been really, it's been nice to see over the last year.
Real world, huh?
Yeah, real world. So I think that we may have pigeonholed ourselves a little bit into thinking that when we do some of these more advanced treatments or things that are unfortunately out of pocket, like IPL, meibomian gland probing, and blepharoexfoliation, exfoliation, thermoexpression, need to be done on our more severe patients. But honestly, some of the results I get in helping to save meibomian gland function is by intervening much earlier in these patients' disorder. And so I think that, yes, while it's still appropriate at severe, I think it's appropriate at all levels.
Yeah. Yeah, it's always nicer to see a patient with a milder disease state when you're thinking about doing these procedures, because I think we know we can help them more. We're going to see more bang for our buck, so to speak.
Yeah. So at-home lid hygiene and therapy is important for everybody. I equate it to dental care. I, don't just sometimes brush my teeth. I don't brush my teeth with soap. We have to use appropriate solutions. We have to use appropriate cleansers that are meant for the eyes on a daily basis to help control the microbiome, right? And just keep it so that we aren't adding to things that are going to worsen the meibomian gland dysfunction. But I think that warm compresses, lid hygiene should be done with everyone every day.
These are chronic conditions. We can't cure these, at least not yet. So we want to get our patients set up for success, and part of that success is them maintaining the improvements we've given them in clinic with therapeutics.
Yeah.
And so at-home therapies, cleaning your lashes, just like cleaning your teeth, cleaning yourself, it's an important thing to do. And so it just sets them up for success. It's an ongoing chronic condition that needs ongoing therapy.
I have a very honest conversation with my patients in order for them to better understand. We learn to, take showers and brush our teeth and wash our face and do all of these things when we're very young. But we as eye care professionals, I think, have done an unfortunately poor job at teaching and integrating this kind of care of the eyelids in our eyes themselves. And so I try to set the stage for the patients to understand that, we need to take care of those areas just like we do everywhere else.
Failure's a great teacher. So you want to follow up with these patients. You want to keep seeing them, and you want to keep addressing the issues they're having with their eyes and their eyelids. Failure is a great teacher in that they're going to come back and they're going to say, I'm not doing so great anymore. I'm having more issues. And we know that that's probably because they got off track. They're not doing the things we've asked them to do. And so getting them back on track and letting them know that this is why you're not doing as well is because you're not doing the things I asked you to. So, I think, again, failure is a great teacher.
Yeah, and I've learned to be understanding with my patients. I ask them when they come in, hey, how are you doing? How many days a week are you doing X, Y, Z? And I take note and I go, hey, look, it's okay. I'm human. I get off track too. And so just not berating them when they do fail or sway away or move away from what we want them to do.
I like to see how my patients are doing in a couple different ways. There's always the signs that I'm assessing clinically. My slit lamp exam, assessing their lids, assessing staining on the cornea. All those clinical findings are very important to me. I like markers such as osmolarity. I like measuring MMP9. I'd love to have more options like lactoferrin and other things that I look for into the future, but also I want to assess how my patient's feeling.
Yeah.
So symptoms are a big part of this disease state, and so assessing those, I like to do surveys and questionnaires.
Yeah.
But just knowing how the patient's feeling is a very, very important part of this as well.
Yeah, if I start patients on a new a regimen, or if I'm adding something in, I will reassess them at about 6 to 8 weeks. And then if they're doing okay at that point, I push on out. But I want to see how they're doing. I want to talk to them about their symptoms. I want to see how's their follow through, right? Are they able to do this and add it in? And then also same measures as far as with looking at signs. So in talking about adherence and patience, I've had a few of my patients, one specifically that I'm thinking of in the last few weeks since I was in clinic, and I've got a lot of snowbirds. They come and go from Colorado because some of them I don't know why, don't like snow. And so when they leave, sometimes they don't bring everything, or they kind of get off out of their habits and their lid hygiene. And one specifically recently came back in town before we were getting ready for winter for their checkup, and said, I have noticed in the last several weeks I've not been doing well, and we've been having forest fires, and we talked about being consistent and getting back on, and it was a good point for us to have a discussion and kind of reinforce why it's important to continue. And the patient even acknowledged that they knew why they weren't doing as well.
A patient recently with really significant rosacea-related ocular surface disease, and after a multitude of treatments, many steps, including some office procedures like IPL and some dermatologic treatments to their pharmaceutical dermatologic treatments to their skin, and then as well as drops for their eyes, we got that under control, and the patient's doing so much better that we actually got to take some of those things away. They're doing so great.
They love when we do that.
We don't need to be as aggressive. We can go down to a more simple treatment plan and do some maintenance IPL, and that might be all you need. So seeing that improvement, being able to get things back to a more normal, healthy, homeostatic state is always such a rewarding part of what we do.
The consensus statement outlines the best practices for managing eyelid margin health as a result of surveying expert faculty, the Intrepid Eye Society. These videos add to the information found in the supplement, previously published by Cookie and available to read and download at the link in the caption. We hope you enjoyed our colleagues continuing to share their expertise on this topic. Follow along with the Fundingsland group to be alerted when they are available.